Risk factors for GERD. While again, there's no one cause of GERD, there are lifestyle choices and certain health factors that can make a diagnosis more likely. These include 1. Living with obesity, 2. Being pregnant, 3. Living with a connective tissue disorder, 4. Smoking, 5. Frequently eating large meals, 6. Consistently lying down or going to sleep shortly after eating, 7. Eating a lot of certain types of foods, like deep-fried or tomato products, 8. Drinking certain types of beverages, like soda, coffee, or alcohol, 9. Using an abundance of non-steroidal anti-inflammatory drugs, like aspirin or ibuprofen. Alcohol and GERD. Alcohol consumption and GERD have been connected in many studies, and it seems like the more alcohol you drink, the higher the likelihood you might develop GERD. While the connection is not crystal clear, does alcohol affect the LES directly, or do people who drink a lot of alcohol also have other behaviors that can lead to GERD? What is clear is that limiting alcohol intake, or stopping it completely, after you've been diagnosed, may provide some symptom relief. Dietary triggers for GERD. Some people who've been diagnosed with GERD find that certain foods and beverages can trigger their symptoms. While triggers can be very personal, there are a few foods that are routinely cited as more triggering than others. They include 1. High-fat foods, like fried foods and fast foods, 2. Citrus fruits and juices, 3. Tomatoes and tomato sauces, 5. Onions, 6. Mint, 7. Coffee, 8. Soda. GERD and other conditions. The symptoms of GERD can sometimes be exacerbated by other conditions you may be living with. 1. Anxiety and GERD. According to research from 2015 trusted source, anxiety and heartburn can be connected. When one increases in severity, the other might as well. It's also possible that individuals living with heartburn or GERD are more anxious because living with the condition can produce unwanted symptoms. If you suspect that anxiety is making your symptoms worse, consider talking to your doctor about strategies to relieve it. 2. Pregnancy and GERD. Pregnancy can increase your chances of experiencing acid reflux. If you had GERD before getting pregnant, your symptoms might get worse. Hormonal changes during pregnancy can cause the muscles in your esophagus to relax more frequently. A growing fetus can also place pressure on your stomach. This can increase the risk of stomach acid entering your esophagus. Many medications that are used to treat acid reflux are safe to take during pregnancy. But in some cases, your doctor might advise you to avoid certain antacids or other treatments. 3. Asthma and GERD. Asthma and GERD often occur together. Trusted source. While more research is needed to understand the exact relationship between asthma and GERD, it's possible that GERD might make symptoms of asthma worse. Additionally, asthma and some asthma medications might increase your risk of experiencing GERD. If you have asthma and GERD, it's important to manage both conditions. Learn about the link between asthma and GERD, and how you can effectively manage them. For IBS and GERD, irritable bowel syndrome, IBS, is a condition that can affect your large intestine. Common symptoms include abdominal pain, bloating, constipation, diarrhea. According to a 2018 review trusted source, GERD-related symptoms are more common in people with IBS than in the general population. GERD in infants. It's normal for babies to spit up food and vomit sometimes. But if your baby is spitting up food or vomiting frequently, they might have GERD. Other potential signs and symptoms of GERD in infants include 1. Refusal to eat, 2. Trouble swallowing, 3. Gagging or choking, 4. Wet burps or hiccups, 5. Irritability during or after feeding, 6. Arching of their back during or after feeding, 7. Weight loss or poor growth, 8. Recurring cough or pneumonia, 9. Difficulty sleeping. If you suspect your baby might have GERD or another health condition, make an appointment with their doctor. If you experience occasional heartburn every so often, you're not alone. Treating these occasional occurrences with OTC antacids and some lifestyle changes, like waiting a few hours to lie down after eating, can usually create relief. But if you find yourself experiencing heartburn more than twice a week and small lifestyle changes don't seem to be fixing anything, you may be dealing with GERD. If you've been diagnosed with GERD, your doctor will help you come up with a treatment plan that works for you. OTC medication, prescription meds, and even surgery are all options, depending on where you are with the condition. Don't let persistent heartburn get in the way of living your life. Talk with your doctor if you believe you may have symptoms of GERD.